When you're diagnosed with arthritis, you automatically start to associate that word with being old. And that's not the case. So you can be a young person with arthritis because your cartilage wore out for whatever reason. It could have been a trauma or it could have been infection or whatever reason. We've done shoulder replacements on patients in their 20s and in their 90s.
We see patients with arthritis and all different types of arthritis, whether it's primary osteoarthritis, which is the regular arthritis, or inflammatory arthritis like rheumatoid arthritis or psoriatic arthritis.
And a lot of it we know is in the DNA. It's hereditary, and then some of it is things that happen to us in life, injuries that occur.
People, when they notice they have arthritis and they start to have the early signs of pain, one of the reflexive actions is to stop using the hand or to minimize activity. And actually the opposite is true. So when you first have early arthritis or those symptoms, often using the hand and continuing to use it and learning to cope and work with it are actually completely safe and actually help improve the symptoms.
Many of the times that I see patients for the first time, they're hearing that they have arthritis in their shoulder, and it's quite profound. That's in part because we can tolerate a lot of arthritis in our shoulder before you would need a surgical intervention. So I encourage patients to come in early to begin discussing options, and with the mainstay of them being physical therapy, injections, and anti-inflammatories.
One key thing I'll just tell patients, once arthritis happens, it's all about managing the symptoms. A lot of it can be splinting, rehab, occupational therapy, sometimes just modifying the activities. Like, for example, if somebody has arthritis in the fingers, just modifying the grip of your racket can actually give you a huge relief when you're playing sports. Whether it's doing injections, cortisone injections can be very helpful. And then there are surgical options. And there are a variety of surgical options for different parts of the body.
Hip and knee replacement in particular, you can take people that are in a wheelchair, not able to really get around more than their own living room, and you can do a single surgery and you can restore their function and reduce and eliminate their pain. And it's quite miraculous.
Arthritis of the foot and ankle is very common, unfortunately, and it can be a big source of pain and disability for patients. Conservative treatments, which we always try to employ first, include icing, resting, bracing, and injections. And people at enough pain and disability, we offer surgery. Specific for the ankle, that entails having an ankle fusion or an ankle replacement, and there's different pros and cons to both of those procedures.
My research has always been to try to cure arthritis. And to cure arthritis, you had to figure out how to make cartilage heal itself or regenerate. And right now, we don't know that answer. When we do, there's over 30 million Americans that will give us a big thumbs up.